Yes, hello. I'm Dr. Mendez-Sanchez from Mexico City. I would like to talk about, the NAFLD. Before this definition, this problem is known as non-alcoholic fatty liver disease, NAFLD. But since 2 years ago, it was proposed another definition, MAFLD. That is probably the best definition, the best nomenclature for this disease, the fatty liver. As you know, in around the world, the first chronic liver disease is fatty liver. Fatty liver affects in about 20 to 30% of the general population. But in some areas like Latin America, it's more common. Unfortunately, we don't have a lot of studies in our region, but uh, a very recent meta-analysis uh, from colleagues from Peru and Chile, they analyzed 19 studies that were done in different countries, especially in Brazil and Mexico. 11 from Brazil and 6 from Mexico and other countries. Analyze the prevalence when in those studies use the abdominal ultrasound, the liver biopsy, and the magnetic resonance. And the overall prevalence that they found, it was about 60%. So it's very, very high. However, as I mentioned before, we don't have studies in our region in the general population. So we need to work in the future to know very well the prevalence of fatty liver in Latin America. When they analyzed in this study the specific groups like obese people and with diabetes, they also found a very high prevalence, more than 60%, almost 70%. So for our people in Latin America, we believe that it is very susceptible to develop this kind of disease, fatty liver. On the other hand, some risk factors like obesity and diabetes. So we have, especially in Mexico, we have a very high prevalence of obesity. More than 70% in our population are overweight or obese. In other countries, in Chile, also the prevalence of obesity is very high. Also, or in the diabetes, that is another risk factor, is very common in Mexico. Almost 12% of our population is affected for diabetes mellitus. So, those two risk factors increase the prevalence of fatty liver in Latin America. And another very important factor is the genetic factor. As you know, the PMPLA polymorphism is very common in our region, in the Hispanic population. And this polymorphism is, uh, uh, is very common compared with another regions like in Asia or Europe. So, but this polymorphism are more common here, but that's the reason our population is more susceptible by the by this genetic factor. So in the future, I think we need to do more studies to very well know the real prevalence because we have a very high, a very important problem here. And when the fatty liver progress to fibrosis, and the fibrosis progression can induce liver cirrhosis and also hepatocellular carcinoma. So now in the United States, for example, the first cause of liver transplantation is the fatty liver, the non-alcoholic liver disease for them, and NAFLD for our region. So it will be a very important problem also in our region as the first cause of liver cirrhosis and also for liver transplantation. How we can detect this problem here? As I mentioned before, we use especially the imaging studies like abdominal ultrasound, but now we have non-invasive biomarkers like FIP4 and non-alcoholic fatty liver disease score that we can use because are more easy to use and calculate or evaluate the presence of liver fibrosis. That is the main point in this in our patient with fatty liver. So in the next year we will see more studies that use this kind of biomarkers. Also in Latin America we have elastography. Elastography that is probably in my opinion is more accurate to evaluate not only the presence of a liver fibrosis and also the fatty liver, the amount of fat in the liver. So for the next year, we will see more studies with this kind of tool like elastography that probably we will know the real prevalence or more accurate prevalence of fatty liver in Latin America. But now in our clinical work, we are seeing a lot of patients with this disease, and some of them also they can develop hepatocellular carcinoma. That's a primary liver tumor that the fatty liver progression can induce. And this tumor can develop without sometimes without the development of cirrhosis. So from the liver fibrosis, it can induce this kind of tumor. And now we are seeing more patients every day with this tumor. So for us, it's very important to know very well the characteristics of the fatty liver in Latin America in order to prevent the progression and the awareness for our population. If they have, if they have fatty liver, they have to go to the doctor. And we need some program in each country in Latin America to identify this kind of patients that are at high risk to develop a chronic liver disease or cirrhosis. Well, thank you very much for the kind invitation. I'm very glad to participate with you in this week of the cancer in UK. It's very important for us that we are participating with you in this project.